You're gonna be warriors after this. I'm gonna die. Right now you're grasshoppers. You cannot take the pebble out of my hand just yet. But it's coming. It's coming, right? That's kung fu, right? Ninja marketing hospitals. If I'm a ninja, I have to do my reconnaissance. Ninjas don't rush into battle. They know their opponent. They look for the weaknesses. So I have to do some reconnaissance before I'm going to even attempt to go for this battle. Once I do reconnaissance and I find out the things I need to do, I'm still not going to rush into battle just yet. I got to develop a plan. How am I going to, I know my information, got my information. I got to attack. How am I going to attack? Now, another thing a lot of people don't know, while ninjas are sometimes lone warriors, ninjas are also part of clans, right? You ever hear of the Foot Clan? Right? What is that from? Teenage Mutant Ninja Turtles, that's right. I am a dork with a capital D, right? Dork, dork, dork. I love Ninja Turtles. Leonardo is my favorite. Who's your favorite? Who's your favorite? Michelangelo. Most people like Michelangelo because he's cowabunga, right? And I'm one person. I can't do this alone. So I need a team. I got to get my clan together to be able to take out this dragon. Once I have all this, then attack. And give it everything you got, coming from every single angle with your team, all coordinated effort. And then 50% chance, if you're lucky enough, stand victorious at the end, you have slayed the dragon. Those are the 5 steps of ninja marketing to a hospital, all right? First thing is the reconnaissance. We have to do some online research. We have to know everything there is to know about this hospital. What are their discharge numbers? What are their readmission rates by disease diagnosis? Not just overall readmission rates. What are their pain points? Medicare.gov is a great resource to go to. All the information I just said about finding about census and discharge numbers and Medicare readmission rates and so on, it's all available on Medicare.gov. Why? Because Medicare is a government payer source, and so that information, if the people are paying for it, it is public knowledge. So you can access it by going through Medicare.gov. Once you do that and you get your information, you get your knowledge, you get everything that you need to know that you can find out online about a hospital, the next thing you got to do is you have to determine who they feed. Meaning, where do they discharge patients to? What skilled nursing facilities are they sending patients to for rehab? What home health companies are they sending patients home with? What hospices, if somebody needs to go on hospice, have contracts with the hospital? What DME providers make deliveries to that hospital every single day? That's what I mean by who do they feed. Who do they work with elder law attorneys ever? Do they work with geriatric care managers ever? We have to find all this out. Are there assisted living communities that they're working with, that they're referring, that we are working with, right? And if not, we still want to know where they're sending their patients. Adult daycares, where are they sending their patients? That's what we have to find out. And I just gave you just think about what I just described. You could see how just the reconnaissance, just from what and this is 3 bullets, right? Just that alone could take you several weeks to be able to find all that information out. But it's vital to your success of being able to infiltrate this hospital. Grasshopper. Go to all the accounts that you're currently working with. One of my favorite ways when I got into that hospital, and I talked about Robert Wood Johnson Hospital in New Brunswick, that's the hospital I developed in 26 days. And my biggest, easiest way for me to get in there was going through all of the communities that I already had established relationships with. So I knew the skilled nursing facilities. I knew the home health. I knew the hospices. I had relationships with all of them. As a matter of fact, as part of like the program that we do with our clients, I teach them to go to there first and then leverage those relationships to get into the account. That's exactly what I did. That's the hurricane way of being able to do this. So go to your accounts and ask them, what hospitals feed you? You know, where are you getting business from? Do you know somebody in there? Do you know those discharge planners? Do you know those nurse liaisons? Do you know their care navigators? And then that's the next part of it. Who are the key contacts in these hospitals? Because we got to know them ahead of time. This is what I love about LinkedIn, and we'll talk about LinkedIn in a minute. But you can usually find like the picture of somebody because most of these people are on LinkedIn. So if you have a LinkedIn profile, you can find all this information on there. Who's the director of case management and the director of social services? That is a very, very important contact. That's almost like the most important contact in the hospital because they're the one on the front line. If you want to get to the rest of their discharge planners and social workers and caseworkers, you have to go through them. If you don't have their blessing, even if you're in there and you're getting some referrals, at any time she can sever that connection. So you got to get to know her. Very, very, very important key contact in these communities. And by the way, so you know the difference, I want to make sure you're prepared for this, grasshoppers, all right? Because you're all going to be ninja warriors after this. I'm telling you, ninja warrior. Who wants to be a ninja? Let me see. Let me see those ninjas out there, all right? I was excited about that. Woo! This is your ninja training right now, all right? Remember your training and you will come back alive, all right? I've been thrown out of hospitals, all right? It's not fun, okay? So... and you're just getting a lecture the whole way as you're leaving. That is I was fatally wounded in that moment when that reconnaissance mission. The director of case management and social services. Case managers manage the client or the patient while they're in the hospital. This is where you get the round-the-clock cases at the hospital because the person needs help. So if somebody has a massive stroke, somebody has fallen and they broke their hip and they're recovering, but they also have like stage 4 dementia, so they don't know. They run the risk of getting out of the bed and injuring themselves and getting hurt. The hospital will contact you. It'll be the case manager who will contact us and say, I have somebody that needs you in order to stay here at the hospital, and they need you. And there's not like how much is this going to cost or whatever. It's your mother's getting this. It's only going to be for the time that she's here unless you decide to do more, but you got to get this family or someone has got to sit here every single hour of the day. Otherwise, she's going to keep hurting herself. That's a great, great client. But again, it goes back to that same day warning I talked about earlier. The social worker is the one who prepares the discharge. So that's the person who's sending them back home into the community. And so obviously that's where we really want to get the patients to, but just so you know the difference when you go in, when you're speaking to one, you want to talk about how you'll take care of the person on site. When you're speaking to the other, you want to talk about how you'll take care of the person at home. Make sense? Yes. Good. Medical directors. Who are the medical directors of this building? The physicians. Many of these medical directors who make rounds, who do surgeries, many of them have private practices. If they do, that is a great place to start because I can find them there, develop the relationship, and then leverage it to get into the hospital. But this is all part of the reconnaissance. So we have to know who those medical directors are. And they're going to be hard to find, all right? But you can do your research and you can find out because, again, this is all public information. And then again, find the MDs who make rounds, who may not be medical directors, like I was talking about yesterday. I think I talked about Dr. Nanavati. Do you remember that when I talked about him at the Elms? And I would go in and I'd see a patient and Dr. Nanavati would walk in and be like, oh, this is Steve. You go with him. He's the best company, whatever. I'll come back in 20 minutes, right? So you want to find out who those doctors are that make rounds at the hospital.
You're going to get a lot of information. You're going to meet other people that are doing the same thing you're doing that you can feed off of. Get information from, get energy from. So I would say come.
This boot camp was so awesome. There was so much energy and information that my head is spinning.
Exactly what I needed. Change my perspective, change how I'm going to do things. not just in my agency, but in my life. I mean, just across the board. I don't know, I'm almost speechless. I know I'm giving this testimony, but I loved it. Absolutely loved it.